President Trump's nominee for U.S. Surgeon General was in the hot seat on Capitol Hill this morning. Casey Means is a wellness influencer and physician, although she does not currently have an active license to practice medicine. She told the Senate Health, Education, Labor, and Pension Committee there is a health crisis in the U.S.
Our nation is angry, exhausted, and hurting from preventable diseases. I've been asked to help our nation get healthy and answer the call of millions, especially mothers, who are begging for transparency and support.
CBS News medical contributor Dr. Celine Gounder joins us now. She's also editor-at-large for public health at KFF Health News. What is the main role of the Surgeon General?
The job of the Surgeon General is to communicate about the science and public health clearly with the American public. And part of what's concerning is many times during the hearing, as well as in the past, Dr. Means has punted, essentially, saying people should just talk to their personal physician. Well, the problem with that is a lot of people don't have a primary care doctor. And even if you have a regular doctor, in the middle of a public health crisis, let's say the next COVID pandemic or whatever it happens to be in the future, you can't necessarily make an appointment with your doctor to ask every single question you have in a crisis. So you need to have somebody like the Surgeon General who can provide guidance to the entire population.
So during the hearing, Republican Senator Bill Cassidy, who is himself a doctor, asked about vaccinations. This is along the point of what you were saying. Let's watch.
Would you encourage other mothers to have their children vaccinated against measles with the MMR vaccine?
Like you, I'm a physician. I believe vaccines save lives. I do believe that each patient, mother, parent needs to have a conversation with their pediatrician about any medication they're putting in their body or their children's bodies.
You're the nation's doctor. Would you encourage her to have her child vaccinated?
I'm not an individual's doctor, and every individual needs to talk to their doctor before putting a medication in their body.
Okay, she gave a similar answer when asked about the flu vaccine. And this is also what we've heard from Secretary Kennedy as well. I mean, notable that Cassidy is a member of the GOP, as I've already mentioned. What's your reaction to that? And what are the risks with that punting, as you said, at the top?
Well, to say this in the middle of measles outbreaks across the country, we have a big one now in South Carolina, in one of our worst pediatric flu seasons in quite a while. It is concerning that somebody who's going to be Surgeon General cannot give a clear message to the American public as to what needs to be done. And to be hedging on well-established science. Measles, MMR vaccines do not cause autism. This is literally one of the most studied questions in medical science. And to leave the door open for spending more taxpayer money on well-established science, frankly, is just a waste of taxpayer money. We should be studying what are the causes of autism, what are treatments, but not something that we already know.
Dr. Celine Gounder, thank you.